Hello, my name is Dr. Cartmill. I'm one of the GPs here at Hall Green Health. I wanted to speak to you about breast cancer screening today. Cancer is a word that none of us want to hear, and that is why understanding the importance of breast cancer screening is important for us all. So the reason we screen for breast cancer is because it is the most common cancer to affect women in the United Kingdom. 1 in 7 women will develop breast cancer in the course of their lifetime. Although we're all afraid of cancer, understandably, screening is not something to be afraid of. Breast cancer in particular is more common as we get older, and that's why the breast cancer screening programme is directed at women from age 50 to 71. At some point, once you've turned 50, you should get an invitation coming through. Don't worry if it's not as soon as you turn 50, but once you've had that first invitation, you'll then be invited every 3 years for the investigation. The test itself is very straightforward. You'll get invited to either a centre or a mobile screening unit. All of the people there helping you through the assessment will be women. You'll be asked to undress from the waist up, and then they will do a special x-ray where the breast is put between 2 x-ray plates and looked at from different angles, and I'm sure most of you know this is called a mammogram. But of those who have an abnormality picked up on the mammogram, only 1 in 4 of those women will actually turn out to have breast cancer. So although it sounds scary, it is really important that if you do get that invitation to attend, that you go, because it is the way of picking up changes early and identifying whether or not they are indeed cancer. And if it does turn out to be cancer, the sooner that it is found, then the easier it is to treat and the more likely you are to be cured of the cancer. So it is definitely worth responding to that invitation and booking that appointment. Now, of course, screening can only pick up cancer that is already there. And so for younger women, or in between your investigations, if you do find something, and it does pay to be breast aware, so when you're in the shower and you're having a wash, if you do notice anything that doesn't look or feel quite right, then let us know, because we can then examine you. And again, the same applies. If we're concerned that there is an abnormality there, we will refer you for further testing, because if we can pick up changes early, and if they do then turn out to be cancer, then the earlier it's picked up, the easier it is to treat. So don't be afraid. Make sure you're looking after yourself, because in this country, we're so lucky to have a screening programme. So make every use of it, because the purpose of it is to keep you well.